Good afternoon. My name is Alexei Danilov. I'm a professor in the Department of Hematology at City of Hope National Medical Center. And we are coming to you with follow-up from the American Society of Hematology annual meeting, which took place in San Diego in December 2023. And I'm joined by Dr. Mazyar Shadman, who will talk to us about his work on acquired mutations in patients with relapsed refractory CLL that progress in the Alpine study. So I will ask Dr. Shadman to introduce himself and briefly describe what the study is about.
Hi, my name is Mazyar Shadman. I'm an associate professor at Fred Hutchinson Cancer Center and University of Washington in Seattle. And it's a pleasure to be here today with you, Dr. Danilov. So this study looks at what we call resistance mutations after use of the drug Zanubrutinib, which is one of our newest additions to the CLL portfolio. So what we tried to look at was looking at patients who on the Alpine trial, and Alpine trial was a randomized trial comparing Zanubrutinib to Ibrutinib in relapsed CLL. And the question was, in patients who took Zanubrutinib and had progressive disease, what kind of mutations in terms of molecular changes that would explain that lack of response or progression, what kind of mutations we see? And out of patients who had progressive disease, we had information in more than 40% of these patients, and we looked at the molecular mutations. And the take-home message is that most of these mutations are, the very small percentage of the patients had mutations that were are already explained for BTK inhibitors. And although we saw a small percentage of patients having mutations that we don't see, for example, after Ibrutinib failure, the percentage remains very small, meaning that we can't make any clinical conclusions or any clinical decisions at the moment in terms of deciding about our CLL medications based on the molecular profile of the resistance. So these are important studies, and they will continue to happen, and we'll have updates in future meetings. But at the moment, the clinical decisions are not based on the resistance mutations, I would say in most cases. And of course, there are exceptions that I'm happy to discuss.
Thank you very much, Dr. Shadman. So do you think in the future, understanding this mutational pattern of resistance will help us define what is the best sequencing of these drugs? And of course, now we have Bruton, which is a non-covalent BTK inhibitor, which has been approved and is effective in C481S mutations, which we see with all of these covalent BTK inhibitors. It seems like maybe with some variability in frequency. But do you think understanding this mutational profile will in the future help us decide what should be the sequencing of these drugs?
I think eventually, and when we have enough data that we're all comfortable that it's comprehensive enough to make such decisions, I think that's the goal, and that will be the direction. I mean, we're all hoping to use every single piece of information to bring it to clinic. I would say to get there, however, we need to, number one, have information about progressive diseases after all these agents, number one. And number two, this is all about the denominator. You need to, I just mentioned that in this study, we had information on 40% of patients with progressive disease. You realize that the percentages can change significantly when this 40% becomes 80%. So yes, if we have a comprehensive database, which is inclusive enough to include the drugs that we have and the reasonable percentage of patients who have progressive disease, then we may find a signal that would inform us in terms of finding the right sequence.
Yeah, thank you. And another question is, do you actually know if these mutations were present before Zanubrutinib was studied? Like if we did some sort of ultra-deep sequencing, do you know if those mutations were there? Or do you know if they all emerged while patients were treated with the drug? Or was there like maybe one cell or two cells which harbored these mutations in BTK?
That is a great question, and I don't believe that on this study we had the baseline information, so it's hard to answer this question on this study. Another study that I'm sure you're covering as part of your program, the Bruton study, looked at pre and post mutational status with a different drug, Brutonib, but we did not have that baseline information on the Alpine analysis.
Okay. Well, thank you very much. Certainly very, very important work trying to understand resistance to BTK inhibitors, which is our bread and butter in treatment of CLL now. Thank you very much, Dr. Shadman.
Of course, my pleasure.